Well, hello again, everybody. Today is Wednesday, September 16th. Welcome back into the Keep Boone Healthy Facebook channel. I'm David Jackson, President and CEO of the Boone Area Chamber of Commerce. And joining us once again, Dr. Scott Elliott, Superintendent of Watauga County Schools. That'll be a great opportunity to get a check-in with Dr. Elliott on just what's going on within the school system and what's coming down the road as we progress a little bit more forward to October and the discussion a few months back about that being a pinpointed time for a possible return to school. So first of all, Dr. Elliott, welcome. Can you give us an update on how remote learning has transpired throughout the system here in these first few weeks?
Yeah, hey, good morning, David, and thank you for having me back on the program. Thanks to you and the Chamber for all that you're doing right now all throughout the community. Yeah, it's starting to feel like October, isn't it? These last few days, fall is in the air, and you know, there are a lot of things that we would normally be doing and planning in schools right now that we're not. No Friday night football or plans for fall festivals, but there is a lot of hard work going on right now with students and teachers. I'm really proud of the work that everyone is doing right now with remote instruction. I've heard from quite a few parents just now that they're seeing and hearing the work that their children and their teachers are doing, just how proud they are and thankful they are of how hard the teachers are working. And I'm certainly seeing that as well. We've come a long way since that remote instruction from back in the spring, where we were you know, doing it on the fly and working day by day. The teachers were really well planned, really well structured, a lot of routine. It kind of has a look and feel as close to school as it possibly can, which, you know, you and I discussed some time ago that this is going to be real school now to the extent possible. On the other hand, it comes with its own frustrations. We still have too many families in the community who live in places where there just is no internet access for them. I was speaking with one of those families yesterday that live in those parts of the communities that you and I both know very well. And it's very frustrating for them, and it's very frustrating for our teachers that they are not able to access their classes and their fellow students and their teachers in the same way that other children do. It's something that I'm hoping that state officials are continuing to work on. But it's going well. We're doing the 2x3 model with our students so that we can follow that schedule once we get them back into school. We also have around 800, I think about 785 students actually, who are in our Watauga Virtual Academy. And that has been going very well. At the elementary level, we kept those children engaged with a teacher at their school. At the middle school level, they are mixed groups from across the county. Those teachers have by far the highest number of students in their classes of anyone. They're working extremely hard right now, but they're all, you know, doing the best they can and doing very well. It's no replacement for having students back in school. And as you may know, that from our most recent Board of Education meeting, that's something that we continue to work towards.
Well, let's speak about that Board of Education meeting. Monday night, there was quite a bit of discussion about what those next steps forward look like. Where are you and the board in that process, and how will you use the next few days to evaluate how you continue to move back toward a time where students can walk in the building again en masse?
That is the goal. The goal is that when it's safe to do so, that we have students back in school. But let me say, as I updated the board on Monday evening, we've had over 1,000 students who've been onto campus for some reason or another. The whole senior class recently who came one at a time safely for their senior portraits. But besides that, we've had about 875 students regularly on campus for some reason or another. Over 400 of those are our athletes who are coming to High School Athletic Association regulated workouts, and those have gone really well with all the safety procedures that we have in place. We have practices 2 and 3 days a week for those students, or for those student athletes. The other over 400 are students who have been coming in every day for our EC, Exceptional Children's Program classes. We have children with severe and profound disabilities that are coming to their classes every day, or alternating days depending on what their plans call for. We have our pre-K program, our 4-year-old students who have been coming every day in all 8 of our programs, and that has been going very well. We've had about 75 students who receive other kinds of services, speech therapy or physical therapy or something like that. They've been coming to campus as needed to get support. And we've also this week begun to bring in students who are struggling even more than other students are with remote instruction, doing individual tutoring with them. And we also have in our vocational programs in career and technical ed, just so many things that can't be done virtually. And this week we started with our auto tech program and our cosmetology program, students coming in doing a lot of their hands-on lab. So we've seen that we've been able to safely bring students slowly back into campus and going into classes or working with students. That's been a great experience for us as we've monitored local conditions. But we now think, based on advice from our local health department and looking at our metrics and seeing how things are going in the community, that we can now begin to safely reintroduce more students onto campus. We are all remote for most students until October the 19th. And I believe that will continue to be the case. The board asked me for options, and I laid out several options for them. One is to continue with the plan to have all students come back on that 2x3 flex schedule on October the 19th. But I also think that we see the benefits of phasing students back into school, so that helps to just continue to work through our screening protocols and working through things like going to lunch and going to PE and social distancing, things like that. So the two other options to consider would be to bring kindergartners, first, second, and third graders back on October the 15th, then bring fourth and fifth graders back the next week on October the 12th, then everyone else on October 19th. Or the plan that I think our board is leaning towards, which is bringing the kindergarten, first, second, and third graders back on October the 5th, then giving ourselves a couple of weeks with those younger students in class, and then bringing the other students back on October the 19th. Why the younger students? Well, I mean, it is probably obvious to many parents and to us as teachers that the younger children are the ones that, for whom remote instruction is just the most difficult. And we have seen that with our pre-K children, that it's very doable and manageable, and the children are very cooperative and follow the routines in a very safe way. So the board has asked to have this week to continue to look at the current metrics, with concern being what we might be seeing as a result of Labor Day and people's travels in and out of the community over Labor Day. But I anticipate that this coming Monday, when they have another brief work session, special called meeting to discuss it, that they'll be making a decision, and that would be either to go ahead with October 19th or to bring students back earlier, most likely that third option with the K-3 students on October the 5th. That's where we are right now.
Dr. Elliott, I know we've talked before about sometimes there are outside of bringing students back and monitoring the health metrics, you're also trying to run an operation that is not just inside the schools, but is outside of the schools as well. And I know a number of business owners and leaders could probably sympathize with your concerns about maintaining operations, because they've been playing this game for the last several months. Now that you've been back in this pattern for a few weeks, how do you feel like operationally the school system is prepared to take on more students and has been able to function even maybe in a different way to get the services done that need to be done with the constraints you're working under?
Well, certainly our core mission is the education of children. And so our business model is a bit different than many others, but in some ways we have so much in common with other business in terms of human resource management, budget management, lots of regulatory considerations, and especially around COVID. And we've been working through these things for months now. We've worked hard as the third largest employer in the community to keep all of our employees on the payroll and with their benefits. That has meant that we've needed to be flexible with some of our employees and their health concerns. We have a number of employees who are able to perform their jobs remotely, many others who cannot, some who have taken leaves of absence because they could not work remotely. So we've worked through that. We've hired quite a few new employees, just like we normally would. So onboarding and orienting those new employees has been really important. And also we've made some significant restructuring to our budget. So a lot of things that we never imagined that we needed to purchase or buy or have on hand, and a lot of things that we probably need right now or we don't need right now that in the past we would have, we've been able to set aside. So as we think about bringing students back into school, we're thinking about, do we need to staff differently? What does the school bus look like? Will we need to have multiple routes? Will we need more bus drivers? As we work through our isolation protocols and our staff members come into contact with COVID or someone who's COVID positive and they need to go into isolation, what does that mean for the need for more substitute teachers or the flexing of roles within the school system? things like that. So we're working through those things. We have plans for those, but of course, plans are one thing, operationalizing or putting them into action or another. Another reason why I think that 2 or 3 weeks with the younger students would be a good way to start the school year.
At this point in time, what do parents and the general public need to know about these next steps and about things they can do to help with the process, if you will, and make sure that the school system and a number of other business concerns in the community have a chance to continue to proceed forward?
Yeah, I want to say thank you to our parents. Parents have been our greatest advocates and our greatest partners throughout all of this. Parents, many of them are very frustrated because remote instruction is not easy. They've struggled with childcare. They've struggled with internet access. Many of them have struggled with having adequate food on hand for their families. This is a really tough time for all of them, and I want to thank them for their hard work. What I want them to know is that we want their children back in school as soon as it's safe to do so. I want them to know that their teachers love their children and want to see them in their classrooms. I also want them to know that we have some teachers and staff members who are concerned about how we move forward with returning students to school. And I fully understand those concerns, and we're trying to help resolve issues or answer questions and concerns, but know that their teachers might also be concerned. And just to keep that in mind as parents are communicating with teachers about the transition back to school. I also want parents to know that that the safety of their children is our top priority, but that also means that we may hit some bumps in the road as we go. We're not going to be returning students to school and everything will be like it was normal. We still are under the DHHS guidelines that require a reduction in our capacity. That's why not all students can return to school right now. We don't physically have the space to spread all students out. So we will need to continue on this 2x3 schedule for a while. There is some discussion at the state level about further opening schools to a plan A. And I was in a call yesterday with the governor's office and DHHS about that. And my advice to them is, that's great. We want our students back in school, but the current precautions that we need to follow to keep everyone safe just don't allow that. So parents know that we're going to be in this 2x3 model for at least the foreseeable future and as we ease students back into school. Parents also need to know that we're going to be fairly stringent about the screening procedures. And they're on our website, wataugaschools.org, coronavirus, we have our reopening guide, and it has a flow chart on it for how we screen our staff members and how we screen our students and what happens if they meet one of the criteria for not being allowed to come into the school. And we're headed into flu season and cold season. We have come through the dry, sort of asthma season. There are a lot of symptoms of COVID that may look and feel like symptoms of cold and flu or vice versa. And we're going to take precautions. So I just, now more than ever, parents need to be communicative with the school and the teachers and keep children home if they are symptomatic or if they are sick, rather than the frustrations of sending them, having them screened, and having them sent back home. If we want to keep schools open, then we need to keep the schools healthy. That means children who are sick are going to need to stay home. It also means that parents and members of the public need to understand the signs of COVID and our screening procedures. So right now, for example, we are asking those 3 questions when someone shows up at the front door. Have you been in contact with someone who is COVID positive? Do you have symptoms of a COVID-like symptoms? Or have you yourself been diagnosed with COVID in the last 14 days? So be aware of that and just don't come to the school if you meet one of those criteria. I would also ask, because what we are seeing is a lot of close contacts and spread within families, that if someone has someone in their family who is symptomatic or who is awaiting a test result because they might be COVID, I would ask that families treat that as though perhaps everyone in the family might be COVID positive and not come to school. We've had some cases where folks were awaiting test results or someone in their family was awaiting test results and they came to school to drop something off or for a teacher conference or something like that and ended up being positive and ended up having we've ended up having teachers go into isolation as a result. So I would just ask, if we're going to keep schools open, we need a lot of help and support in taking those precautions, even as frustrating as they are. Last thing, David, it's, as I said in the board meeting the other night, it takes a whole community effort. So these rules and these precautions are not just about complying and getting back into school. We really need to follow these precautions out in the community. We've done a great job. Conditions have not been as bad as everyone, I think, feared and thought it might be with the return of ASU and other things going on. We're beginning to somewhat flatten the curve here in the county, and has not been as severe, but that could change. We should not let our guards down. We need to be careful about large group gatherings, our church groups and youth groups and clubs and ball teams and going to the store and things like that. Following the 3 W's is the greatest thing that our community and parents can be doing right now to help us get back into school.
Well, we certainly appreciate all of your information, your transparency during this process. I know you and your staff and the teachers in each of the schools have been working incredibly hard to make this as seamless as it possibly can be. I can tell you from one end user's perspective, it's been a good experience. I know our kids want to get back into school too as soon as possible, but to know what the process looks like, I think helps people plan quite a bit, and especially around work schedules and things like that. So appreciate all your information, and I am sure we will talk again about this at some point in time here in the future, but thanks again for joining us today.
Thank you. We'll get the word out very soon after the board meet next week, and I look forward to talking to you again soon, David. Thank you.
All right. Sounds great.